Hi, welcome to Medical Monks, where your care is our highest calling. My name is Nikki, and today we're going to take a look at a family of products from a company called Hartman. They are a family-owned company, been around for about 100 years. And what we're looking at today is a line of products called Proximel. They are a silicone foam dressing. All of these come in 5 different sizes, the 3x3, 4x4, 5x5, 6x6, and a 4x12. All of those products actually come in silver alginate. We call those AG, so it's Proximel AG. And what that means is it's infused with silver. Now, what does silver do? It's really kind of cool. What silver does is actually inhibit the growth of bacteria by keeping the microbes themselves from actually respirating, reproducing, and then once it actually kills the cell, those cells become zombie cells, and they in turn actually kill the remaining living bacteria that may be in that wound. So the thing about Proximel that's actually really cool and puts them a little bit above their competitors is that a lot of AG actually tend to drop off that efficacy after day 2, whereas Proximel has labs that have verified that they actually continue with that action well past into day 7. So this is something that's going to be efficient, it's cost effective for you, and will get the job done. They do come in non-bordered, but today we're going to take a look at the bordered dressings, which just probably obviously means that they actually have a border on the outside that is sticky and adhesive so that you don't need a secondary dressing to keep those in place. So this is something you would use when you don't actually need a pressure dressing to wrap around some other wound, all in one inclusive. What does Proximel do? First of all, it's 5 layers of protection. And the first layer you're going to start with, or they started with, is something very similar to your own skin, and is the protective backing. It has something called a vapor transferring layer. And that is something that just basically means any of the exudate that has come up from the wound surface is being drawn out to the very top, and then it is evaporating, while that top layer is actually keeping in anything that is harmful to the air. You wouldn't want to be breathing that stuff in. So it really does function like a secondary skin. The second layer is the Superabsorbent Core. The superabsorbent fiber layer has exceptional absorption capability, and it helps minimize maceration risk, which is just a fancy way of saying it tries to keep all of the skin intact and not actually contribute to any more injury by tear. The third layer is the nonwoven layer, which helps spread fluid to a wide surface area to enhance absorption performance. Now, what that means is it actually spreads out that moisture across a surface area so that it can be wicked up into that top layer we were just discussing earlier. Same with that fourth layer, which is the absorbent polyurethane foam, which actually has the added benefit of having a lot of cushion for comfort. Now I'm going to stop here and explain why that's a good thing, because not only are we treating wounds, this is something you would want to use to prevent wounds. So on bony prominences, perhaps on an elbow or a hip bone or an ankle or a knee, even anywhere where a loved one is lying in bed for a long period of time and is exerting pressure on that area that may end up with a very sensitive skin. And it also comes in a very important sacral size. What is the sacrum? It is the small of our back. And that is something that actually is pretty predisposed to getting bed wounds. This is important for anybody in a care setting who is going to be in one position for any length of time, where their own body weight may actually create those pressure ulcers that can be especially painful. Also is the heel. A lot of diabetics have issues with pressure ulcers on their feet, so there's one that is especially contoured to fit the heel. So we're not only treating wounds, we are talking about preventing them. That fifth and final layer might actually be one of the most important, because it is not only tacky and it adheres to the entire wound bed, but it protects the actual wound itself. So it's not actually causing damage or pain to that wound, but it is adhering to it. And it's perforated, and that's important because it's allowing, again, that exudate to draw up into the other 4 layers, and then the vapor can evaporate out into the atmosphere. A question you might have and patients have had in years past is, do I need to shave a particularly hairy area, for instance, a forearm? The answer is no, you do not. You may use Proximel on top of hair. It won't pull, it won't cause pain when you remove it, and it still adheres. This is important because even though we're told you don't necessarily want to be peeking at a wound, you may actually want to check on a progress of one, and so you can actually remove that carefully. It won't disturb the healing going on underneath, and reposition if needed, or just take a look at what's actually happening underneath the surface there. Thank you for joining us. I hope you learned something that might help you take care of yourself or a loved one. If you liked what you saw and you'd like more content, please hit like and subscribe and stay up to date with us. Thanks so much.